Hi there, I'm Bonnie Adam, and I'm going to show you some acupressure points for back pain today. This video is by request, so it already took me so long. I know it's been a while since I had that request, and it's just been kind of a crazy time, but here we are. Now, strangely enough, a lot of points that are going to help you with back pain are not on your back, which is helpful because how can you reach your own back to give yourself some points to help with that? It's really hard. So I have some points that are sort of general pain and inflammation points that you can use on the hands, the legs, and that kind of thing that will help just sort of open up areas of your body and release pain that way. First one being large intestine 4. Now this point you do not use if you are pregnant, please, okay? But otherwise, anyone who is generally in good health can use these acupressure points without any problems. So large intestine 4, take your hand and find, you've got your thumb bone here, and then there's another bone behind it, it's the thenar bone. We're gonna go about halfway along that bone and slide forward so that you're between your thumb and your forefinger, and that squishy area in there, you just press. And these points you can massage or press, and you're only pressing to the point, like if you find a good spot in the point, it's gonna be a little bit tender. And that's a good thing, you're gonna work it out until that tenderness is worked out. But not pressing hard enough to leave a bruise, hopefully, just working it out, and enough until you just feel it. And you do them for about 30 seconds to a minute, whatever your tolerance is, right? And then you can do the other side, and kind of the easy way is just to go between like that. I'm kind of twisting myself so you can see with the camera, but you just find a comfortable way to do that, right? Large intestine 4. And this point releases all kinds of pain in the whole body. It's one of the best points for pain in our bodies, especially for pain in the head, neck, face, teeth, toothache, releases sinuses and that kind of thing. But it's good for the lower body as well, because if you can't reach your lower body, you can use this point still. One of the interesting things about this point, there is a BBC documentary called The Science of Acupuncture, and they go through some testing with this point, and they actually find that when they stimulate this point, it fires up the pain centers in the brain, and that's really cool. But anyway, on to the next point. So, and some of these points are going to be very much the same as points that I may have shown you for stiff neck, because, it's the spine, basically, and the muscles surrounding the spine that we're working on. So another thing you can try is small intestine 3. So I'm on the baby finger side of my hand, and you find the area between the bone and the palm of your hand. And if you dig in there, there's like a little channel that runs up and down. That's a meridian, little channel, little meridian. And you can stick all 3 fingers in there, or you can just work, one point at a time. There's actually 2 points here. About a third of the way down is small intestine 3, and about 2/3 of the way down, or up from the wrist, is small intestine 4. And they're both really good for back pain. Small intestine 3 more specifically for neck pain. But there you go, that's another place you can work. Another place that's really handy is lung 7. I was trying to figure out how do I turn my hand so you can see. So you come down your thumb, and on this bone of your wrist here, so it's like the top bone of your wrist, there's a little knobbly bone in there called the styloid process. And if you go just down from where your wrist bends, and if you turn your hand that way, you can find it sticks up more. And in between there, you're in between 2 tendons, and they attach onto that little styloid process, so you can turn your wrist and do stuff with it. But if you press right in between there is lung 7, and lung 7 helps to release the whole back of the neck and the head, and good for sinus as well, but also good for pain in the back, upper back more so than lower back, but it's easy to reach, so why not throw it in there, right? So lung 7 in there. I do have an ebook. If you're finding these hard to see on camera, the ebook has diagrams and descriptions as well. It's on my website, pathwayshealing.com, on the shopping page. So if you're interested in learning more, you can grab that, or you'll have little diagrams you can print out and take with you, or have on your phone, whatever. You can also use points at the back of the neck to help with stiff neck. So I'm going to go through the same ones I just did in a previous videos for stiff neck, but put my hair out of your way here and turn myself around, and you can see the back of my neck as I'm here. So underneath the base of your skull, you have these big bony areas or fleshy areas that stick out, and right underneath there, there's a bit of there should be a little bit of a dent in there. And you can get your fingers right in there. I'll show you. So you come down underneath the base of the skull, and press into that area, and that is gallbladder 20. And I usually recommend, like, it's nice if you can lay back and do this, because you can lay back and relax on your bed and, you know, get in there and massage in behind gallbladder 20. And you can kind of massage down your neck a bit. And then you can also find below your last cervical vertebrae. So it's called C7 if you're looking it up. You want to get, the way you can tell is it's the last one that turns when you turn your head, okay? And it's the biggest bone at the bottom of your neck. And if you go down to the next bone and try to feel it and you turn your head, it doesn't move. So that's part of your upper back vertebrae. It's not part of your cervical neck vertebrae. So if you find that one, go like, oh yeah, that one's moving, that's the one. And if you can't, if it's not, you know, you're not getting it, then just go to the biggest one and underneath it. So you're actually sticking your finger underneath that bone, you know, in between the two vertebrae, and pressing gently, of course. You're on your spine, so you're gentle there. And you press in there, right underneath, and press. And then you can, as far as you can reach, you can press on either side. So you could go beside that spot where you just were, underneath the vertebrae, and then about an inch or an inch and a half on either side of your spine, there is a whole series of acupuncture points that go all the way down both sides of your spine, and they're wonderful points to work for back pain. So you just find the first little dent underneath that vertebrae we're talking about, and then go out a little bit and press there. And then you can go down to the next one and press there, or as far as you can reach. So try and find those little those little spaces between your vertebrae, and then go to the side and press. And then if you can, reach down, and you can even just generally press on that area, and that will help a little bit. So those are some areas. I'm probably getting nice and red there. You know when your skin's getting red that you've done a good job, and now it's time to stop because you don't want it to be all marked up. And another place you can go is gallbladder 21. And that is basically right on this trapezoid muscle, right? This muscle that holds all the tension in our spines all the time, or in our necks. So if you go to the base of your neck here, and to the end of your shoulder, and about halfway back, so about halfway from the neck to the edge of the shoulder, same thing on the other side, and just press in there. And it'll be tender if you've got it. So you're just pressing into that trapezoid muscle. It's called gallbladder 21, and that releases a lot of tension in the neck. This one you would want to be very gentle if you were pregnant as well. So just a little gentle there. You can also just like pinch that muscle, like go in front and behind and pinch it, and just pinch the whole muscle up. That can help too. Now I'm going to stand up and turn around so you can see my back, because if you can reach your back, you can do some of these points as well. So I'm going to stand up here, take off my little sweater, and okay, I don't know if you can see this very well, but if you go to the bottom of your rib cage and then travel your thumbs back over, if you can reach this far, right there is a point called bladder 23, and it benefits the lower back, and you can just press there. Now this one, press a little bit gently, because this is right over your kidneys, and you never want to put too much pressure on your kidneys. They're probably working pretty hard anyway. So if you start there, or wherever you can reach, and work your way down, same thing I did on the upper back, you can do on the lower back. So you could start there and just kind of go down, you know, to another point. So if you can feel your vertebrae, you'd be going just in the space between the two vertebrae, and just basically press, you know, as hard as you can, or as hard as you can reach, or whatever, and press there. And then go down an inch or so between the next vertebrae and press again. And again, you could hold these up to a minute or so, and then down and press again. And you'd have to press pretty hard to harm yourself here, because you've got lots of muscle and tissue in the way here, especially if I have lots of muscle and tissue there. So, and you can press, you can just keep going all the way down, you know, basically to the base of your spine and into your upper buttocks, you know, and press into those areas. And you kind of like, it's where the muscle is the highest, right? About an inch and a half or so from your spine, but also where this muscle raises up. Your spine is indented and the muscle is higher, and then you start sloping off again. It's where the muscle sticks out the most. And you can kind of press around wherever you like in there, really. And press and hold. You could even, sometimes I've taped 2 tennis balls together. So, you know, get some duct tape or something and tape them together. Or even the little smaller racket balls or squash balls. They're a little smaller if you're really sore and you don't want the tennis balls feeling too big and uncomfortable. So tape them together and put those underneath your spine and roll your back up and down on them very carefully. And that will pressurize all those points as the balls roll up and down your spine. So there's a couple other points on the legs that we can do as well. So I'm going to just switch my camera around so I can show you some of those. Hi there, I'm back with some more points for back pain and general health. So I'm going to show you a point that helps to tonify all your organs and strengthen your whole body. It's sort of, we call it a tonifying point in acupuncture and acupressure, which means basically strengthening or firming up your body. So it's called stomach 36, and here, this is my knee here, in case you're wondering the way the camera looks. And what you do is, here's your shin bone, right? If you run your finger along right beside your shin bone, you are in your stomach meridian, and you come right up, basically where your finger sort of runs into some resistance because the bone is flaring out there. So you come up to just sort of underneath where that bone starts to flare out and press in there, and that's stomach 36. So the tonifying point. And this is a great point for anybody to use. It's good for digestive health. It balances your digestion. So whether you're having you know, you can't go to the bathroom or you're going to the bathroom too much, this point will help, so you go ahead and use it. Another point then that is good for all kinds of muscle pain, helps release all muscle pain in the body, especially the lower body, is gallbladder 34. They say gallbladder 34 moves the chi, it moves the energy. So when you have pain, that means the energy is stuck. We want to move it, right? So same thing as stomach 36, but you're going to kind of lump over this muscle here. And there's another channel down the side of your leg. And if you try to like explore your legs and your arms a bit, you'll start to find these channels. There's a bone, and then there's a muscle, and on the other side of that muscle is another channel, gallbladder channel. And you're going to do the same thing. Run your finger up until you start to feel the resistance of the bone flaring out there, kind of stops you from moving your finger up, and push on gallbladder 34. And again, you do one leg, then the other leg, right? And this is a good muscle releasing point. Another good one for lower back is underneath your knee. So if you, in the crease behind your knee, about halfway between this side and the inside, and you go under there and press up into that crease. It's called urinary bladder 40. UB40. There was a band called UB40 when I was young. Anyway, so pressing into there, and that's a really great point for back pain again. And another one is if you feel your calf muscle here underneath, it kind of bulges out, and then there's a little notch underneath it there, and it's right in the middle behind your leg, so halfway between the outside of your leg and the inside of your leg. Feel that calf muscle, and it's almost like there's a little kind of a V in there. It's right in the V, and that one is really good for releasing back pain as well. And then a couple other ones are, sorry, losing my mind here. Urinary bladder 60, which is right at, let's see if I can move my foot there. So if you find your ankle bone, then just go right behind the ankle bone and before the Achilles tendon. So right between the ankle bone and the Achilles tendon is urinary bladder 60. And that one's a really good one to work for back pain and neck pain. Also pairs up really well with small intestine 3, that one we talked about on your hand, on the baby finger side. And I'm going to switch legs here, so we'll jiggle the camera a little bit to the inside of my foot. And a really good point to use for strengthening and tonifying and raising your energy, and also for the knees and the back, is kidney 3. And that's the same as urinary bladder 60, except it's on the inside of your foot, and you find the top of your ankle bone there. And sorry, my feet are a little bit funny shape because I had surgery for club feet, so please excuse the scars, but I still do have an ankle bone in there. So find your ankle bone and then slide your finger in between the ankle bone and the Achilles tendon again and press in there. And that one will help raise your energy and help your knees and your back. And you can also sort of squeeze
kidney 3 and urinary bladder 60 at the same time, right? So just finger, sort of almost grab your Achilles tendon and get in between your Achilles tendon and your foot and squeeze both sides. So then you can do 2 points at once. So I hope those are helpful for you. You know, if you can contort yourself enough to reach them all. If you can't reach them all, just do the ones that you can reach. And relax and breathe and know that your pain will go away eventually. And if you need help, find, you know, a qualified acupuncturist in your area and go and get a treatment, okay? And have a great afternoon or great day, and I will be back with more videos soon.